Chief Medical Health Officer Dr. Saqib Shahab says people need to do three things this holiday season: get the vaccine dose they're eligible for, including their third dose, upgrade their mask, and reduce their contacts. But unlike other provinces, Saskatchewan isn't introducing limits on gatherings or reducing capacity in public places.
Some provinces with large surges have not gone into full lockdown, but they have gone into like 50% capacity restrictions. And certainly, if we see a surge, that is certainly something that I would recommend that we reduce our capacity by 50% in all public venues.
Shahab released new modeling on Tuesday, which showed Omicron cases doubling in Saskatchewan every 5 days. That's a slower pace that has been seen elsewhere. The modeling also suggests that without any interventions, cases could surpass 300 per day by late January. Modeling says that with interventions like reducing population mixing, cases could be fewer than 50 per day over the same time period. Shahab says if cases do spike, the response will have to be prompt.
But we have to be quick. We have to be nimble. With Omicron, we can't take weeks to make decisions. Decisions have to be made in hours to days once we start seeing a surge.
Last week, Premier Scott Moe said he would not be introducing new measures because of Omicron. In BC today, the government announced that it was shutting down bars and nightclubs and shutting down events like weddings and large parties. Shahab says people in Saskatchewan need to do their own risk assessments. He says places where there's been a proof of vaccination or negative test policy has seen very little transmission with Delta and were considered low risk. Shahab says Omicron is more contagious and those settings are now a moderate risk.
I think we will have more transmission with Omicron with current measures than we've seen with Delta over the fourth wave, like in common areas, including hospitality sector. And then we'll have to adjust accordingly. Again, as long as it's not impacting the health system, the aim now is not to prevent every single case, but to keep case numbers manageable and to prevent a sharp, sudden spike.
Shahab says the more people can reduce their contacts, rapid tests, and receive their shots, the better off Saskatchewan will be in combating Omicron. Adam Hunter, CBC News, Regina.